Morning, Paul.
Morning. How you doing?
Good. How are you?
Pretty good.
Good.
Pretty good. It's a Friday and good weather, so
Oh, it's such a beautiful morning.
yeah. Uh, But the weekend's gonna bring a little different story, but
Yeah.
we need the rain. So
Yeah, we really do. Yes, indeed. You working today? Or are you off?
uh just got off this morning, work
Oh,
last night,
okay.
so
Gotcha.
yesterday. Yeah. So
Good morning.
Morning.
Good
morning.
morning.
Harry said that he is going to try to hop on, but if we have a quorum, he's going to hop off if he's not needed, if that makes sense. He has another meeting that conflicts with this one.
Yeah, my 19-year-old got up yesterday at like really early, left the house before 6 a.m. We're like, "Well, something's up." And then around noon, I started getting text messages with photos of him standing next to Al Capone's grave in Chicago.
Oh my gosh, that's awesome.
Yeah, it was fun.
Surprise.
Right.
Yeah, that is probably not what you were expecting.
Nah, no.
Uh,
Is that what motivates kids to get up at 6 o'clock in the morning? I
Apparently, it's definitely not
need a little
school.
advice here. I can't get mine to get up, so maybe if they anticipate a road trip to Chicago or wherever. So
Worth the shot, Paul.
Yeah, he went by himself, which, you're crazy. Frontal lobe not fully developed until age 25.
right, right.
I love it. You never know what they're gonna do.
That's great.
I see that the red AI meeting notes have logged in. This is something that's happening with all of our virtual calls. If you guys don't want that on, Avery, I think you can probably kick that participant out.
Okay. Um, it's up to you guys. Just let me know.
What's it doing?
Hey, basically, it just kind of transcribes what happens during the meeting and sends it out to all the participants. I mean, since this is a recorded public meeting anyway, it's probably not that big of a deal, but for some of our meetings, it's not. So not everybody wants it on.
As long as everybody understands the minutes are the official record of the meeting. So I got one, two,
So I think right now we only have 4 members online. We might have just gotten one more. Yep, there's Mayor Adams.
I'm here. Paul's here. Rebecca's here. Mary's here. Lori, Brandy. I've got 6.
Yep. We had a few more accept the meeting invite. So let me see.
Lori's on. Just got to turn on everything.
I can run down the hall and see if Belinda is going to jump on. Yeah, I'll go run down the hall real quick and see if she can hop on.
Yeah, because we're too short right now.
Yeah.
Where's all of our friends this morning?
I don't know.
They all took Friday off and forgot about the meeting.
I believe that.
Hard to believe anybody would miss an insurance meeting to do something else on such a beautiful Friday.
I mean, it doesn't get much better. I can tell you as soon as this over, as soon as we're finished here, I'm leaving to go to Nashville.
Nice.
Awesome.
We may or we may not see Keith Urban.
Hmm.
He canceled the show last night due to his vocal cords, and the doctor put him on rest and blah 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 blah.
Hmm.
Oh no.
Know a girl that's touring with him, and she's not give us the inside scoop yet either, which is knowing her is why we bought the tickets and the whole family's going and blah blah blah. It's like, stay tuned, they haven't canceled yet, so I'm not sure how you cancel in Greenville, South Carolina on Thursday night because your vocal cords are out of whack, whatever. But you think you might make Bridgestone in Nashville on Friday. So we're going. If he cancels, he'll make the tickets good later. Not a big deal. But we got a motel room downtown that we can't cancel.
Yeah.
So
Renaissance Hotel.
be in Nashville, and we're gonna find something to do. I don't know what that's gonna be, but it doesn't matter because we just went through a wedding with my daughter a week and a half ago. That's been going on for 2 years. We're ready to get away, even if it is only for one night.
Hey, I don't blame you. Been
You
there.
earned it. Congratulations.
Thank you, thank you. It was absolutely perfect. She got everything she ever wanted. Thank God. Thank God, out of the 3 kids, we only got one daughter. She's the last one. We got them all married, and they're on their way, and they're very successful. And
That's awesome.
Harry just popped on.
yeah, we found Harry.
Yeah.
Harry, don't worry about sleeping in this morning. We were waiting on you.
I wish I was.
All right, need one more.
So, Belinda wasn't here, but let me give her a call real quick and see if she's available to hop on.
How many members we up to now? 19.
Hmm?
How many members we have overall?
17.
17. That's 17. So
One, two,
she has 16. 58. We still need 9.
yep, 17. Give her a call, and then I can try to call Mr. Roach or Sarah Florence from Pendleton County Ambulance. Real quick.
Oh, I had a brain fart. I totally forgot about Terry. Let me call. Terry's at the KGA meeting.
Okay.
Oh gosh, that's right. Let me confirm that that's still today as well. Totally forgot about that.
Mr. Chairman, if I think the only agenda item that might require a vote is the rescribe program. If we want to move that up, perhaps, so that Harry can get to his other meeting.
Yeah, no, that'd be great.
Okay,
But I got to get quorum first.
sure. Yes.
Six, 7.
Somebody just logged on with the name iPad.
That's me. I'm Carissa from Crescent Springs.
Perfect. So we're at 8. We need one more.
Right.
Okay.
Remind me about. We don't have proxies, do we?
Any jurisdiction can send anybody they want, as far as I'm concerned.
Okay, hold on a minute. Let me get Derek on the phone. I think I can find Derek, which is operations manager from Carrollton Utilities. Give me just a second.
Right. Thank you.
Okay, I had that all screwed up. Terry's back. He's at the coffee shop with Derek. So that's what they do at 9 o'clock on Friday morning. And they're heading to the office now, which should take them about 2 minutes. And he'll log on. I would say he went to the conference, got totally sidetracked with the conference that he needed to be back on the meeting today. So
Hey, Brandy, are you able to turn on your camera?
I'm working on it, Craig. Hold on.
I appreciate everybody's forbearance. Hopefully we'll get this going in a few minutes.
It's like Terry's logging in.
Yeah, I'm trying to. Can you hear me?
We can
Yep.
hear you.
Trying to find my camera here. Let's see. It's the first time doing it on my phone. Here we go.
There you go.
Great.
Sorry about that.
All right. Brandy, if you can keep working on your camera, we'd appreciate that. In the meantime, I'll go ahead and call this meeting to order at 9:14. I will Madam Secretary, do we have a quorum?
Yes, there are at least 9 member entities represented.
Okay, great. I will entertain a motion to approve the agenda with the change of moving the rescribed discussion to directly underneath the minutes.
So moved.
So moved. Second.
Motion made and seconded. All in favor, please say aye. Aye.
Aye.
Aye. Any
Aye.
opposed? Right, great. Next item is the approval of the minutes. We have two sets. I'll entertain a motion if there's no questions to approve those as submitted.
So moved.
Moved by Harry. Second by Mayor. Mayor Adams. Any discussion or changes? Hearing none, all in favor, please say aye. Aye.
Aye.
Aye. Any opposed? Great. Next item on the agenda is the Rescribe International Drug Sourcing Program.
Okay, I'm gonna try to share my screen. Avery might have to allow me to share.
You should be able to share now.
Okay. Okay, can everybody see that report?
Yes.
Okay, so The Rescribe program is something new that is available through MedBen RX, and it's the kind of thing that we would normally bring to you in January when we talk about future plan changes and new programs that you could adopt for implementation in July. But this one is such a win for the plan and the member. And there's so much savings potentially available that we didn't want to wait until next July to implement it if you're inclined to want to do it. So what this is international sourcing of non-specialty brand drugs. You already do international sourcing for specialty drugs, but now we're able to do it for drugs that are less expensive than specialty, and they're drugs that a lot more people take. And it's a completely voluntary program. If somebody's on one of the drugs that is included here, the Rescribe team will reach out to the member and ask them if they want to participate. And if they do, they get their drug for free. It gets delivered directly to their home, and the plan gets it at a greatly reduced cost. It's usually about 30 to 40%. So you'll see, for example, Jardiance, that's a diabetic drug that a lot of people take. The plan savings for that drug based on your level of utilization over a 12-month period would be about $25,000, and the member would save about $3,400. Um, and so on an annualized basis, they converted it to a 12-month number. The savings would be, well, it's the same. Yeah, 25,000. Okay, so there are some fees associated with the program, and you'll see those right here. Estimated program fee, $7,700. It's all baked into the drug costs when the plan pays their share of the drug. So it's just one of those situations where there's really not a downside to doing it. Everybody wins, and we wanted to bring it to you just as soon as we could. We do have groups who are using it very successfully. It's been very popular. The only thing that we would recommend is if you decide you want to do it, we've got some flyers that are member facing that we would ask you to distribute to your employees so that when Rescribe contacts them or somebody from MedBen RX, they know that this is a legitimate program. It's not a scam. So the savings that we're projecting are about $211,000 for the plan over a 12-month period, and the member savings is about $45,000.
And that number is based on if everybody got every prescription through this program?
I think they used a 75% estimate. Is that right, Brooke? I think that's what we typically do. 78%. Okay.
Okay.
So it's kind of a conservative projection.
So I know when I have to process the specialty drugs through the HRA, there's some paperwork that needs to go back and forth. I guess that would be handled through the Rescribe program in MedBen directly.
Yeah, and you shouldn't even have to do that in the future on the MedBen RX specialty drugs because we moved it to the BPP. So that was when we were still using RX Help Centers.
Mm-hmm.
So there won't be any paperwork for you to handle or for any of the entities to handle. It's all done behind the scenes.
Okay, great.
And the drugs come from Canada. It's the same medication that you can get here domestically. It's just that we're able to purchase drugs a lot less expensively from other countries than we can here.
And do these costs reflect possible tariffs?
No, if the tariffs end up applying, then things would be reassessed, and if it didn't make sense to run a drug through the program, then they would take that drug out.
Right. That's all the questions I have. Does anybody else have any questions?
Lisa, just curious, so this is for anyone that's currently taking drugs. Is there like steps in place for anyone that would have like a new prescription? Or would they take that to their, local pharmacy, get it at least the first, month filled, and then would Rescribe reach out, or is there any way to do this initially on new prescriptions?
Well, I mean, you send out the flyers, so if somebody is aware of the program and they get prescribed a new drug, they can certainly use that for their first fill. If not, if they fill it through the plan, then the people who are, monitoring things behind the scenes will see that there's a new prescription for an eligible medication and they'll reach out.
Okay. And typically, I mean, do you know what tier drugs these are? I mean, you say they're not specialty, so does it usually fall within like the two or three?
Yeah, it's going to be all 2 and 3. It's not the generic drugs, so nothing in tier 1.
And will you also see like a substantial savings for anyone that has like RX option A? Because I know those are usually fixed co-pays.
Yeah, I mean, the savings for the member won't be as great on those drugs because they have lower copays, but the plan savings will be more on those because the
Oh,
plans
I
pay
understand.
more of the burden on those medications.
Sure. But you say that if they participate in this, that even that smaller option A copay will be $0?
Correct.
Okay, so there is some motivation. Again, sometimes when they're paying $30 or 75, and then we see that the plan pays thousands. I know
Hmm.
sometimes that motivation for the member, but if they understand that it would cost them nothing, it'd
Right.
probably be worth the time, right?
Right. I mean, it
Okay.
costs them nothing and it gets delivered directly to them. So,
Oh, excellent. Okay.
Mhm.
And will this
So we
usually
would,
be like a 12 month? I'm sorry. Will it usually be
no,
like
that's
a
okay. Go
12
ahead.
month, or will they have to call in or do something every month, or uh, is this something where like once they participate in it, it'll just show up at their doorstep, every month or until the prescription runs out?
Well, a lot of these drugs require prior authorization, and the prior authorizations are usually good for 12 months.
Okay. All right. Thank you.
Yeah. Uh-huh. And we would recommend that you go ahead and make this effective at the earliest possible date, which will probably be December the 1st.
Yeah, I'm kind of cheating and looking ahead at the MedBin report, and I went to the pharmacy page, and these drugs represent 14% of all the scripts that are written, but they represent 85% of our pharmacy cost. So, knocking this down would be a very good thing for us to do.
Absolutely. Great point, Mr. Chairman. And some of these diabetic drugs are hitting your plan and every plan really hard right now. So Ozempic and Manjaro, Farxiga, they're all on the increase because of the all the publicity around the weight loss properties of GLP-1. So they're in high demand, and they're really driving your pharmacy costs. And anything we can do to get these at a lower price point is a good thing.
Does anybody else have any questions?
Logistically, how does it work if a member wanted to use it? Who do they send their script into, and how much work on the front end is it for them? Because sometimes that can simply be a deterrent.
Brooke, do you want to talk about the mechanics of what that looks like?
Sure. So we pretty much handhold them in getting the information that we need to process their scripts. Once we get that information from them, we determine what address they want us to ship it to. We guarantee that the medication, because some of these medications need to be like refrigerated, we guarantee that it'll get there within a 2-day turnaround time, and that if it needs to be refrigerated, it will stay within those parameters. There's actually like thermometers that go into the shipping process, and if it gets over that, MedBin will cover the charge if the temperature goes off. Was that answer your question?
Yeah, it does. As long as you get that member that says, well, that's not worth it. It's just too much paperwork, that they have somebody they can call that's going to walk them through it. Now, I understand you probably shouldn't have to do that, but that's the world we live in. So something a little more as easy as we can make it
Mhm.
get to go this route?
Yeah, it's pretty smooth. So when we've implemented this into groups, you do have to make it voluntary. You can't make people go through this. And with that, with with them getting the medications for free, we have about a 78% compliance rate. So members that move from traditionally picking up their medications through a specialty pharmacy or wherever they're getting it to the international sourcing, we have about a 78% compliance rate.
And the savings that you talked about here, this 211,000, was based on if 78% of the people use it. If only 40 or 50 use it, it's still that much savings.
Correct. Yeah, you're going to see a savings regardless. With the cost of the medications typically being between 20 to 30% cheaper. And then, the members are also getting it for free.
Anybody else have any questions? Anybody have any comments?
Just one last thing for employers, which is who we all represent, as well as our employees. But as we give it out to our employees at each entity at home, while you're trying to sell it to them, it'd probably be a good sales tactic to let them know that not only can it save you money, but if it's a drug that's not costing you anything, it's easier to say, well, it's free to me, so I really don't care about the plan. I'm not going to do it. It's already free. That on the back side of that, sometimes it's not about you. It is about the company and the plan. And it could come full circle to say, the more that you help us save our plan money, it's possible that's longer that your employee is allowed to, like in Carrollton, we pay the whole family plan. If you're married and got 19 kids, we pay the premium. You don't pay a dime for it. So the more you save the plan, the less the plan has to raise the premiums, which could affect you on the backside. Does that make sense?
Mm-hmm.
So that's just a good sales tactic because you're going to have some like, don't cost me anything, so I really don't care. Well, there may be a day when you do care.
All right, cool. Anybody else? All right. If you can unshare the screen so we can see everybody. There you go. If there's no further discussion or questions, I'll entertain a motion to accept and join this program.
I'll make the motion.
Harry, thank you.
I'll second.
Whoever.
I'll let you all figure out who seconded it. All right. If there's no other discussion or comments, all in favor, please say aye.
Aye.
Any opposed? All right. Thank you much. That takes care of the voting portion of the agenda. Next item is the financial report.
You guys have a great day. I got to go.
Thank you,
Thanks,
sir.
Harry.
Appreciate the time.
Thank you.
Okay. Let me share again. Second. Lost my document. Okay. So we have a new format for the financial report. It's a little different than the one we used to use now that we're participating in the Jefferson Health Plan. And this comes out monthly. So I'll walk you through it here. It has all the same information in it that we had on our older reports. It's just laid out a little differently. So I'll focus on the year-to-date number. That's these are the totals from July through the end of September, so first quarter. And of course, you started with a zero balance. And you have earned investment income of about 1,300. Accruals, that is actually the premium that all the entities pay into the plan. And that has been about 1.5 million. So total revenue of about 1.48 million. And then you've paid about $1 million in medical claims, $125,000 in pharmacy claims. So your total claims are about 1.14 million. So the large claim reimbursement fees, that is their way of saying stop loss premiums, as are aggregate protection fees. So your total stop loss premium or large claim reimbursement program fees are about 207,000. And then JHP does have some administrative fees, and those totaled about 16,000. And then you still pay administrative fees to MedBen, and those were about 76,000. Sherrill Morgan made about 21,000. So your total TPA and JHP and broker fees combined were about 97,000. The federal healthcare tax, that's the PCORI fee, that was about 1,600. So your total plan expenses were 1,461,000. And for the first quarter, then you're showing a little bit of a surplus, almost $20,000. So any questions?
So just a friendly reminder that that $19,000 is just the amount of money we have sitting in the Jefferson Health Plan accounts. We still have our other accounts, and they're in excess of $2 million once you add all them up. So that money you're used to seeing on that report is still there, and we may just have to start doing a new report to kind of show what all those balances are, so you can see those. Any questions or concerns regarding the financial report? All right, thank you. Next on the agenda is the MedBen first quarter plan review.
Okay, can everybody see that all right?
Yes.
Okay, I'm going to walk down through your 3-month update. So we have claims from July through September of this year. You can see in the first 3 months, you had about $917,000 in medical claims, about $243,000 in pharmacy claims, for a total of about $1.2 million. When we annualize your claims out through the end of the year and take out anybody that we think might hit your specific deductible and fulfill that aggregating specific deductible, you're right around $4.5 million, which is a projection of about 11% below where you ended up last year. Again, we're in our first quarter, so it's still pretty early, but we'll continue to monitor. You did have an increase in your enrollment. So when we take that into consideration and annualize your claims out, we're projecting you to be down about 14%. And then large claims make up about 16% of your total. You have 7 individuals that we consider a large claimant on your plan right now, which I'll walk you through. But that makes up about 16% of your total spend year to date. Okay, if I look at this next page, just looking time period to time period, so the first 3 months of this year compared to that same time period last year, your medical claims are down about 21%. Your pharmacy claims are up. The main reason that your pharmacy claims are up is because your diabetic therapies have increased about 31%, which I'll talk about when we get to the pharmacy report. But that's really the main reason that you're seeing an increase in your pharmacy claims. When we look at it on a per member per month basis, it's not that big of an increase. And when we factor in the medical claim reduction, you're down about 19% from the first quarter of last year to the first quarter of this year. Okay, so good news there. Looking at some of the cost drivers within your health plan. So again, I mentioned that your pharmacy is up, you're above our benchmark. with that with you implementing international sourcing, that's going to directly affect that per member per month cost. Inpatient claims are down significantly. You're well below our benchmark, below where you were last year. You had fewer admissions in the first 3 months of this year compared to last year, and a significant decrease in the number of inpatient days. Outpatient claims are also down. You're at $270 per member per month. Our benchmark is $317, and you're below where you were last year. Your per member per month on office visits is also down, despite you seeing an increase in utilization across the board on your office visits. And then post-acute care has dropped. So all good news there. Just looking at a few things from a medical utilization standpoint. So you did have fewer people have a medical claim in the first 3 months of this year, and we paid and processed fewer claims. So we paid and processed 2,710 claims so far this year. Your average cost per medical claim that we processed dropped pretty significantly. Last year, you were pretty close to our benchmark, and this year, you're well below our benchmark at $338. And then looking at your coverage tiers on a per member per month basis, your employee spouse coverage tier on a per member per month basis is the highest, followed by employee, and then employee non-dependent spouse, which is employee child, and then family. Out of your large claimants, 4 of them are employees and 2 of them are spouses, which is driving this spend. You can also see that their risk score for that population is higher than the other populations. Okay. Looking at your top hospital spend, St. Elizabeth continues to be your most utilized provider, and it's your top paid provider. The different locations are broken out because they bill under different tax ID numbers, but if you added them all up, they would be your most utilized and top paid as well. Children's Hospital is also in there. You had 28 members go to Children's. It represented about 11%. Or 52,000.
Hey, Brooke, is Carroll County Memorial not on the list because they're used so little that they're part of the other?
Yeah, they're probably falling into the other. If a
Okay.
hospital didn't have over $9,000 in claims, then it's not going to show up on this list. It's just being bundled in this other category. Okay. So total facility spend right around $479,000 compared to last year, same time period, you were about $618,000. So significant reduction in those hospital claims in the first 3 months of this year. And then inpatient admissions. The cost of your inpatient admissions so far in the first 3 months are about 30% below our benchmark. 3 of your 5 inpatient admissions were medical and 2 of them were surgical. You had a total of 13 inpatient days. Last year at the same time, you had 9 admissions and a total of 101 inpatient days. So significant reduction there.
Can you go back up just a couple slides there to right there? The Murray Callaway County Public Hospital Corporation, is that somebody that was likely out of town and had to go to the ER or something?
There were 4 members that went there. That's in Western Kentucky. I can look to see who it was, but you had 4 individuals that went to that hospital. It's a very rural hospital, so.
Right. And that seems like one person that went to that hospital would have made much more sense on the explanation, because you could have, you know, it would make sense that they were out of town, they were in that part of the state, and some haven't had to go. But 4 going to the same hospital that far away just seems odd.
Yep, I can take a look. I can pull to see who it was, and the reason for going. This isn't, this is your claims from last year, so this isn't this year.
Okay, yeah, no, we're good. Go ahead.
Could have also been people away at school. Could have been multiple students.
Good point.
Yeah,
Yeah,
Murray State's right there.
Yeah, don't because Murray State is there. You're right. Yeah, don't take any time to look that up. Just go right on.
Yeah, they weren't. Yeah. Okay. Outpatient imaging, you had 36 total scans. You didn't have any PET scans. They were all MRI or CT scans. From a cost standpoint and a utilization standpoint, you're below our benchmark. Children's Hospital was the top paid provider for those scans, followed by the St. Anne's and Fort Thomas. And then emergency room utilization, your ER visits are right around $1,900 a visit, where the plan picks up the majority of that. You can see down below, the majority of your ER visits fell into a high or a very high severity category. You had 39 total ER visits this year, and last year at the same time, you had 43. So you've seen a slight reduction in your ER visits. Only 10% of them were considered potentially avoidable, but you did have one individual that went to the emergency room 6 times. And if our benchmark for the avoidable visits is 11%, and if I go to the ER visits, so the ones that we flagged as potentially avoidable, you had 2 for back pain, 1 for constipation, and 1 for a strain or a sprain. So if those 4 visits went to, say, an urgent care or an office visit instead of going to the emergency room, your potential for savings was right around $2,500. Okay. Any questions on that? Okay. Talking about large claims, so they're all still active on your plan, or they were still all active on your plan at the end of September. The good news is, out of your top 7, 5 of their prospective risk scores are going down, which typically means that their claims will also go down. Their risk isn't as high looking at the future 12 months following the plan. You do have 2 individuals that their risk scores are going up. One has a diagnosis of cancer, one has a diagnosis of end-stage renal disease. The good news about this one is we're paying those claims at a percentage of Medicare, because it falls into a category where we can do that with there not being the possibility that the member gets balance billed. So we're paying those claims at 125% of Medicare, which is a significant reduction if you were paying them like in a standard PPO network arrangement. So if you added all their claims up, this year, right around $307,000 in large claim activity. Last year, same time period, you had 6 individuals that hit the same threshold of $21,250, and their total claims is right around 406,000. So a reduction in your large claim activity this year, although you have 1 additional person, and because it's a first quarter update, 3 months, we didn't use half of your specific deductible to determine who the large claimants were. We actually went down to 25% of your specific deductible just to give us a better idea of where your large claimants were so early on in the year. So that's why we used $21,250. Any questions? Okay. This next page is just graphs of everything I just went over. And then page 20 are your utilization metrics on a per 1,000 basis so that you can compare yourself to our benchmark, how you stack up against our benchmark. And then page 22 are your actual metrics. So this is where I was comparing your ER visits from this year to last year. Your urgent care visits also dropped this year. But you can see a steady increase in all of your office visits, total office visits, routine actually went down, preventive went up slightly, mental health went up, and substance abuse, you had 2 additional visits.
And we did have some additional members on the plan this year, so that's probably accounting for some of the increases in things like office visits.
Okay. Looking at additional preventive services, so you had 8 colonoscopies this year, which is an increase from last year, and you had 15 mammograms. Okay. All right. Looking at chronic conditions, so these are listed on a per member per year basis. So taking claims in the first 3 months of this year and annualizing them out through the end of the year. Because one of your large claimant has end-stage renal disease, you'll see that listed at the top, as well as chronic kidney disease, and then congestive heart failure. So those are your top 3 chronic conditions. And then taking a look at your behavioral health dashboard, you've spent about 25% less on behavioral health this year than you did last year at the same time period. We know of 70 individuals that have a behavioral health diagnosis. The majority of them have some type of mood and anxiety disorder and seeking treatment from an office visit. The majority of people that have this type of diagnosis is 10 to 14. And you can see you did have some ER visits associated with behavioral health, 2 in July, 2 in September. Okay. And then cancer dashboard, we know of 11 individuals that have cancer. 2 of them have breast cancer, 1 of them has colon cancer. The majority of them are males on your plan and their employees. The majority of people are seeking treatment from St. Elizabeth on an outpatient basis. And then your diabetes dashboard, we know of 66 people that have a diagnosis of diabetes. That's a few less than what we knew of last year. 2 potentially undiagnosed. 55 of them are medical utilizers, and 63 of them we have prescription claims for. The majority of them have type 2 diabetes. What you've spent on a medical standpoint on a per member per month basis this year dropped compared to where you were last year, but the cost of the pharmacy, the cost of the scripts went up. And then your top diabetic medications are Mounjaro, Ozempic, and Jardiance. And then well living compliance. So this was updated on October 9th. You can see annual wellness exam compliance is 48%, cholesterol 68, colonoscopy 51, mammogram 61, pap smear for members 21 through 29 is at 57%, and over 30 you're at a 50% compliance. So as the year progresses, we typically see those percentages increase. And then pharmacy, we talked about this a little bit. From a generic utilization standpoint, 86% of your prescriptions are generic medications. From a plan paid per member per month basis, you're right around $114. We know that the cost of your prescriptions went up about 16% this time period. The cost that you spent on Manjaro jumped pretty significantly, which is what we're seeing for a lot of our groups. You can see last year, same time period, you had paid about $8,000 for Manjaro, and this year you're right around $47,000 on Manjaro. Ozempic is also a GLP-1. The cost of that went up. Or wait, I'm sorry, the cost of Ozempic actually went down. And what we're seeing is people that are on Ozempic are now getting on Manjaro. So you have some movement from Manjaro or from Ozempic to Manjaro. And I bet that's what happened here. Jardiance and then Eliquis, the cost of those both dropped. Okay. I'm going to jump. Here you can see, okay. So these are your top 20 medications, and it shows you the increase from the prior periods to the prior 3 months, what we're looking at. Manjaro was ranked 6th out of your top 20 medications last year. Now it's number 1. It's not a generic medication, but you can see that went up significantly. Vivitrol, you didn't have this hitting your plan last year. Dexcom, that's also for diabetes, and Ajuvy. So the top 5 medications listed here are for Jardiance, or are for diabetes. And you can also see on this page, lumping all the diabetic therapies together, your plan saw from the first 3 months of last year to this year an increase of about 31%. You also saw an increase in non-opioid pain medications. Last year you spent about $5,000. This year you spent about $17,000. Any questions? That's pretty much the 3-month plan update.
Thank you. If there's no questions, we'll move on to the Jefferson Health Plan update.
Okay, the first thing is JHP asked us to remind everybody that the payment for your monthly contributions is due by the 10th of the month, and adjustments should be sent to billing at thejeffersonhealthplan.org. And then also, I included in the materials some flyers regarding their EAP program, which is a nice value add that you get with JHP. All of the entities are already enrolled, and so you can send those flyers out to your members if you want, and they can take advantage of what is offered there. If there's enough interest, we'll schedule a call with somebody from JHP to go over their EAP program. We'll send out an email to see who might be interested in learning more about it. But it doesn't cost you anything. Your employees can take advantage of it at any time. So that is everything on the JHP update.
Great. And the next item is the interlocal agreement update.
Yes, so it was approved by the Attorney General's office, and now it's with the Secretary of State, and we're just waiting for a letter back from that.
Wonderful. All right, so that concludes the listed agenda items. Anybody have anything else?
Sorry, I just have one question. You indicated, is there going to be a flyer that's going to be sent out for the rescribe that we can send out
Yes.
to our employees? That's going to be sent out, I guess, to all the board members, and then we
Yes,
can.
we'll make sure
eliminate it.
everybody gets a copy of that, and it should come out within the next few days now that we have an effective date.
And again, that effective date's December 1st. Is that
December
correct?
1st. Yeah.
Okay, thank you.
Mhm.
We have down that our next meeting is January 23rd. So with that being the case, I'll go ahead and wish everybody a happy holiday season. And is there anything else before I entertain a motion to adjourn? All right. Hearing none, I will entertain a motion to adjourn.
Motion.
Terry, anybody else?
I'll second.
Second, Paul. Great. All in favor, please say aye. Aye.
Aye.
All right.
Thanks, Greg. Thanks, everybody.
See y'all next year.
Take care.
Thank
Bye,
you.
everybody.
Y'all have a great